Hey everyone, and welcome. Today, we're diving deep into one of the most powerful treatments out there for totally renewing your skin. Yep, this is your complete guide to chemical peels. So let's just start with a simple question. What if you could kind of hit a reset button for your skin? Peel back the years and reveal a smoother, brighter version of yourself. Well, in a nutshell, that's exactly the promise of a chemical peel. So, what's the big deal? What can this treatment actually do for your skin? Let's get into the key benefits right now.
The results can be pretty amazing, honestly. We're talking about smoothing out rough texture, evening out your skin tone, making fine lines less noticeable, and even tackling those really stubborn things like hyperpigmentation, those dark spots, and some kinds of acne scars. But the real magic, well, that happens a little deeper. Peels actually stimulate new collagen, and that's the stuff that gives our skin that firm, useful bounce.
So how in the world does it work? I know, the name chemical peel can sound a little intimidating, but it's not as scary as you might think. It's actually a very, very controlled exfoliation. A specific chemical solution is put on the skin to remove those outer layers in a super predictable way. This whole process basically kicks your skin's natural healing response into high gear, telling it to generate fresh, new, healthier skin cells. Okay, so before you run out and book an appointment, it's absolutely crucial to know if this treatment is even right for you. Let's talk about who is and who isn't a good candidate.
And let's be crystal clear on this because safety is everything. Chemical peels are not for everyone. If you have any active infections or open wounds, if you're pregnant or breastfeeding, if you've been on isotretinoin recently, or if you have a history of keloid scars, that's a type of raised scar, then a peel is off the table for you. Seriously, safety first, always.
Now, if you are a good candidate, the next step is kind of like mapping your route. See, not all peels are created equal, and picking the right one is all about your specific skin and your ultimate goals.
Peels basically come in three main depths. You've got your superficial peels. People sometimes call these lunchtime peels that are great for dullness and getting a quick glow up with very little downtime. Then you have medium peels, which go deeper to work on fine lines and pigmentation. And finally, deep peels, which have the longest recovery time but are used for more significant wrinkles and scars.
Just to give you an example, at that superficial level, you'll hear a lot about glycolic acid, which is fantastic for improving overall texture and tone. Then there's salicylic acid. Because it's oil-soluble, it can get right down into your pores, which makes it an absolute superstar for anyone with acne-prone skin. Your provider will choose the right one and the right strength just for you. Okay, and this might be the single most important message of this entire explainer. Chemical peels are not a DIY project. We're talking about powerful acids here, and they absolutely must be performed by a trained, licensed professional who really understands skin and knows how to handle any potential issues. Please don't mess around with this at home.
All right, so you found a great professional, you're ready to go. What does the procedure itself actually look and feel like? Let's walk through it. It's a very methodical 5-step dance. First, your skin gets a really good cleansing to get it prepped. Then, all the sensitive spots like around your eyes and lips are protected. Next, the peel solution is carefully brushed on and timed down to the second. After that, it's neutralized to stop the chemical reaction right in its tracks. And finally, a nice soothing cream is applied to start the healing. And while that solution is on your skin, what are you going to feel? Well, it's super common to feel some stinging, a little tingling, or a warm sensation. Don't worry, this is totally normal. It just means the acid is doing its job. And your provider will be right there with you, monitoring you the whole time. The procedure itself is pretty quick, but the journey isn't over when you walk out the door. In fact, what you do next is so critical. This is the recovery phase, and this is where the real transformation happens. So for a typical light or medium peel, here's what to expect. On day 1, you'll probably have some redness and your skin will feel tight. Then over the next few days, that classic peeling and fleeking starts up. But by about day 5 to 7, you'll start to see that beautiful, fresh, new skin coming through. Your aftercare routine is completely non-negotiable if you want a good result. The rules are simple but vital. Do use a super gentle cleanser and do slather on a healing moisturizer. The big don'ts, absolutely under no circumstances pick or pull at the peeling skin, and stay out of the direct sun and heat. And your new best friend, your ride or die, sunscreen every single day. That brand new skin is incredibly vulnerable, and protecting it with a broad-spectrum sunscreen of at least SPF 30 is the #1 thing you can do to protect your investment and prevent new damage. So really, when you boil it all down, a successful chemical peel journey comes down to just 3 things.
choosing the exact right peel for you, having it done by a qualified professional, and being incredibly diligent with your aftercare. You get those 3 things right, and you're setting yourself up for amazing results. So now you have the map. You know the what, the why, and the how of chemical peels. The final question is one that can only be answered in a one-on-one consultation with a pro. Is this journey the right one for your skin? Thanks so much for joining us.